Good afternoon. Since Tuesday, April the 14th, we have seen a 32% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 1,273 reported cases, 290 people hospitalized with COVID-19, and 42 deaths. We remain committed and focused on scaling up our response to this emergency while continuing to leverage the wealth of medical and public health expertise here in Baltimore City. Last week, we launched our dashboard to provide residents with essential information to help keep residents informed as we progress through this national emergency. And after the state released racial demographics data, we have incorporated that information into the dashboard. This is a great tool for residents to get up-to-date information, and I highly recommend that they take full advantage of the dashboard. The public-private partnership has also worked to make sure we're getting the word out to all of our communities through a broad-reaching advertising campaign. This campaign began online today and will roll out to TV, radio, outdoor, social media, and transit advertising for the next 3 weeks. The message is clear and simple and echoes what we've been asking the community to do in the event they are experiencing COVID symptoms or have come into contact with someone that has been diagnosed. Call 211 and you will be connected to a trained healthcare professional. I will reiterate the message of the campaign. Call first, stay home, save lives. This operation is critical in supporting people from the safety of their homes. We cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can save lives. And we're asking your help in minimizing your contact with hospitals and healthcare facilities during this time. Baltimore, we have seen progress in flattening the curve, but this is no time to rest or let up. Everyone needs to stay home unless you are going out for essential reasons. Every time you leave your house, you put yourself and everyone in your household at risk. Now I will ask Baltimore City Health Commissioner Letitia DeRosa to come up and update you on our COVID response and our work to support the residents of Baltimore.
Good afternoon. Thank you, Mayor Young, for your leadership, and thanks to my colleagues and our partners for their continued support. There are a few updates that I would like to share today. First, I would like to remind Baltimore City residents that the city's website, coronavirus.baltimorecity.gov, has documents and information that answer many COVID-19 frequently asked questions. Our website also has our COVID-19 case count dashboard. We encourage all residents to visit this for the most up-to-date case counts in Baltimore, broken down by zip code, gender, and race, based on the available information that we receive from the Maryland Department of Health. Second, our testing site at Pimlico Racetrack continues to serve a role in reducing the strain on our hospital system via community-based testing. On Tuesday, April 14th, 162 residents were tested, and on Wednesday the 15th, 98 residents were tested. We know there are a lot of questions around the COVID-19 cases at Future Care Lockern, and I'd like to take a moment and talk about what we know. As was reported on Wednesday, there were approximately 170 lab-confirmed positive cases reported at that location, which included a mix of both residents and staff. The health department is actively reaching out to contacts of lab-confirmed cases to provide guidance on self-quarantining and what to do if they experience symptoms. One of the first steps the health department took when we first learned of the threat of the coronavirus pandemic was to create GO teams to deploy to long-term care facilities around the city to provide logistical and material support. We know that outbreaks of infectious diseases, including coronavirus in nursing facilities and other spaces where multiple people live and interact with one another, are common. In this case, this particular nursing facility took a very aggressive approach to do surveillance for COVID-19 by testing everyone, even those that were not symptomatic. The advantage is that this mass testing allows us to identify cases before individuals begin developing symptoms and can help with making decisions around cohorting or grouping together residents that test positive in an effort to streamline patient care and reduce further spread of infection to residents who are negative. A state strike team visited this facility on Wednesday to support with assessments and logistics, a model similar to our own local GO teams. They provided tactical guidance around infection control. At the local level, we will continue to support our nursing facilities and other congregate settings with our GO teams and by providing additional PPE and supports as needed. We appreciate the state's assistance in supporting this facility. Casing at nursing facilities around the state show why it's so important to follow social distancing guidance. Baltimore City and the entire state of Maryland are still under a stay-at-home order, meaning that residents should still remain home as much as possible unless for an essential reason such as going to the grocery store, the pharmacy, or going to work if you are an essential employee. The stay-at-home order is not a curfew and is enforceable at all times throughout the day. You're just as capable of spreading COVID-19 at 10 a.m. as you are at 10 p.m. Residents should stay home practicing social distancing day and night and should only go out for essential reasons. Thank you all, and please continue to practice social distance and stay home except for essential purposes. Thank you.
Thank you again, Dr. Zavasa, for all of the work that you do. Next, I want to talk about our local restaurants and the thousands of Baltimoreans they employ. Like so many of us, they have taken a big hit, and their whole business model has been disrupted by this pandemic. I want them and all the residents of Baltimore to know that I have reached out to the major food deliveries apps, DoorDash, Grubhub, Postmates, and Uber Eats, to request that they cap their delivery fees at 15% for our residents. We have all been hit hard by this pandemic, but it is how we work together and support each other that will forge a path out of this crisis. And when we come out, because we will, I pledge to continue to fight to make sure we have a fair, more equitable economy that works for all of us. Before I open it up for questions, I have one more announcement today. I'm happy to announce the expansion of technical assistance and business support services available to Baltimore City-based businesses. Through a new public-private partnership between the City of Baltimore and the Baltimore Small Business Support Fund, Baltimore City has more than 12,000 small businesses, including over 3,500 minority and women-owned enterprise and numerous small profits. At this time, these businesses urgently need additional support and access to technical expertise to make informed decisions about their business challenges and find solutions in these uncertain times. The Baltimore Development Corporation and Mayor's Office of Minority and Women-Owned Businesses are partnering with the Baltimore Small Business Support Fund to assemble a technical assistance network that will help small businesses complete application for appropriate federal, state, and philanthropic financial assistance programs that are currently available, and federal programs that are expected to be replenished in the coming days. As we have seen over the last several weeks, the demand for funding is great. This network will allow small businesses to position themselves to be prepared as funding becomes available from a variety of sources. We will now take a few questions.
Has there been any decision made on expanded testing sites?
Dr. Shavasa, I think we have a few, right?
Yeah, so we're actively looking to expand beginning next week, and we'll have more information next week, but we're looking both on the east side and west side to expansion.
Do you know at this point of
Me?
the deaths in Baltimore City?
Can't hear you.
Of the deaths in Baltimore City, are they, you know where they are? Nursing home related?
We would probably have that information on the back end, but no, I don't know off the top of my head.
At Lockern, what's the status of those particular?
So we're not going to be reporting out on those things individually at this time.
Mr. Mayor, I know you had talked to us earlier about reaching out to MTA. You were reaching out to MTA to try to get a handle on those packed buses. We continue to get like pictures of passengers packed on the buses. How is that going in terms of your
Well, after I spoke with Mr. Quinn, who is the CEO, he said they were looking at how they can adjust that, and I'm quite sure they're trying to do that. But as you know, when people get on the bus, they're gonna get on the bus, and we're trying to make sure that they do the social distancing when they get on the bus. But if a bus driver stop here right now, and there's 20 people, they're gonna get on that bus, even though we know we don't want all of them piled up on that bus. So I asked them would they look at how they can have more runs so that people can get to work on time, because most of the people that's catching the bus are essential employees who have to get to their job. Like it was one gentleman yesterday, he said he waited for the 76 for an hour and it still hadn't came. So I called Mr. Quinn. He said we're going to make sure he find out what was going on with that bus and try to get a bus out here to get him to work. So, we're asking people who really do not have an essential function to stay home and not get on the bus when we're trying to get people who are essential employees to work.
Also, Mr. Mayor, you just mentioned the flattening in the curve seems to be going well in Baltimore. There's progress, is what you said.
Yes.
In terms of flattening the curve. Does that give residents a sense of relief? Does it give you a sense of relief? What are you doing?
I don't have a sense of relief right now until we see no more cases of coronavirus in the city of Baltimore. That's why my message to most of the citizens are to stay home. If you're not going to your job, which is essential, or you're not going to the pharmacist or going to get some food, you don't have no reason to be out. Stay home so you can help us flatten the curve. Because like I said earlier, if you go out and you mingle, you're taking it back home to your loved ones. Maybe it might be your mother, your grandmother, or some other member of your family, and that's how it's spreading. So if you really don't have to go out, we're asking you to stay home.
Now that schools are going to be closed at least until May 15th, is the city doing anything additional regarding the digital divide and food handout stations?
Well, we're going to be working with the school system to find out, what resources they have and what resources they need, and we'll try to work with them. But as you know, the school system have their own, they have their own board of school commissioners, and they're separate really from the city of Baltimore. We own the buildings, but we're going to do everything we can because these young people belongs to us. They belong to the city of Baltimore. And wherever we can help the school system, we're going to be there to do what we need to do.
How can the city help small businesses who weren't able to
I can't hear you.
How can the city help small businesses who weren't able to apply for the Paycheck Protection Program?
Well, I just talked about that earlier. We're going to have technical assistance with BDC and our small business organization within city government to help them go through that lengthy process. And we're also going to be announcing some things that we're going to be doing on, I think that's on Tuesday. So we recognize that our small businesses are hurting, our restaurants are hurting, and we want to do everything we can to make things more easier for them as well. Because we're all in this together, like we oftentimes say, we're all in this together.
Do you have any update on the budgeting process?
We don't have any updates on the budgeting process right now. We're facing the same challenges that every city around the country is facing. We're no different than they are. And everybody have to look at their budgets to see what we can do to make sure that we are functioning, make sure we're able to buy the PPEs and all of the things that our public service workers need. So we're no different from any other municipality. We all have financial problems. The refundable stuff that we can charge the federal government for is things that's COVID related. But it's not going to pick up shortfalls on our budget, So we, as the county execs around the state, we all been working together, working with our federal delegation to ask the federal government to give us some leeway in how we can help with our budget shortfalls as well. And the U.S. Conference of Mayors, we have done the same thing, and the African American Mayor Conference is doing the same thing. And National League of Cities, and MACO. We're all in this together, so we're all pitching to our federal partners and to the federal government what our needs are,
Think layoffs may still be on the table?
Well, that's the last thing I ever want to talk about is layoffs. So what we want to do is we want to work with the unions and everybody that's involved to make it as less painful as possible. And I'm not even looking at layoffs right now. You know, we gave some scenarios of what would happen if, in fact, we have to do what we need to do. And I think some of the things we laid out was very, very good. So I don't want to lay off anybody, especially in a pandemic like this. All of us need to be working. People still have mortgages. They still have to pay gas and electric. They still have to pay for necessities to keep alive. So that's the last thing from my mind.
What's the level of compliance with the mask?
The level of compliance.
Yeah, what do you notice?
Well, earlier today I had to go down to the Office of Emergency Management, and as I rode, I seen people with their masks on, like I had mine on. So I think most people are complying. I've seen people going into stores and they have their masks on as well. You might have one or two that's not doing it, but the majority of the people are doing it, and I'm happy that most of the people are taking this serious.
Can we ask,
Question for the commissioner.
can we ask a quick commissioner question?
Commissioner, as you probably all know, there are some issues over protesting over the shutdowns and closures across the country, including one coming up here scheduled in Annapolis this weekend. What precautions or procedures, if any, is the Baltimore City Police Department taking on that particular issue?
Well, thank you for that. Number one, we continue to enforce social distancing as we have from the beginning. We continue to enforce the governor's executive order about stay home. And in anticipation that this would happen, at the very beginning, we began to make sure our members were educated on our policy, and we began giving refresher training to several hundred of our members in the mobile field force should we find the need to have to deal with protests and or civil disturbance. So we began preparing for this in the very beginning to make sure we were ready for it. Just before this, I was on a national conversation with chiefs from across America who are dealing with this in real time right now. So we're working to educate each other on how this is unfolding and what needs to be done about it. We're prepared for it.
Do you anticipate anything in Baltimore?
I do not at this time. There's no intelligence to suggest at this moment that we'll face that. However, the department did its due diligence very early on to make sure, should it happen, that we'll be ready for it.
I know that's kind of a reverse for the police department to tell people to put on a mask as opposed to take off their mask to be identified. But how are the officers handling that?
Well, the officers are embracing wearing the mask. They're wearing their mask, they're wearing their equipment, and we have not yet started, to my knowledge, to receive complaints about businesses complaining about people coming in not wearing masks or their employees not wearing masks. So those are things that we're waiting for. But to my knowledge, we have not started seeing massive amounts of those yet. The officers are wearing their masks, and they're happy to receive them. We need more to give out.